At this time, we'd like to convene our press conference and thank you for your patience and thank you for your attendance and thank you for helping us communicate to our community what's going on, what are the issues involved with this influx of immigrants from Central America that are coming to and coming through our area. And what we're talking about is some of these are the figures that have been provided to us by the U.S. Border Patrol on what's occurring. 48,000 immigrants were detained by Border Patrol last month, mostly from Central America, the countries in Central America being Guatemala, El Salvador, Honduras. 20% of these individuals were unaccompanied minors. 1,100 undocumented immigrants are being caught every day by our Border Patrol, are being detained. They're not catching them like in a sense of the word. In fact, the immigrants are looking for them. They want to be in their custody. They want to be processed. They want to be detained so that they can get one of those NTAs, notice to appears, and then they can, once they get that notice after they're processed, then they're able to travel freely throughout our country. What we're finding is that they are coming through here, they are being processed, but they're not staying here. They're getting on a bus and moving on up to their final destination. 160,000 immigrants have been caught this year compared to 154,453 for all of last year. Now, what we've tried to do is we try to put a panel together, assemble a group of individuals that are knowledgeable in the areas that are being impacted, or at least in the areas that our community has had some more questions about. That's the area of public health. How are these immigrants, the influx of immigrants affecting our public health here in our area? Public safety, the impact that this has had on our law enforcement community, the impact on our communities themselves, the impact on our school districts, the impact on our county resources. And what we've done is we're here to answer your questions, and we can start. We've got the individuals involved. We have our Hidalgo County Sheriff, Mr. Eddie Guerra. We have our Hidalgo County Emergency Management Coordinator, Mr. Oscar Montoya. We have Mr. Eddie Olivares, our Executive Director of the Hidalgo County Health Department. And we have Sister Norma Pimentel, who's supervising and in charge of the effort being put forth by the Catholic Charities organization and other faith-based groups. And they're here to answer any questions that you may have, or try to answer it in any event. Monday? We also have from the Texas Department of Public Safety, Commander Joe Rodriguez. And for the City of McAllen, we have the Mayor and the Emergency Management Coordinator, their attorney, Mr. Kevin Pagan, also here to respond to any of your questions. With that having been said, why don't we go ahead and proceed?
Judge, let me clarify one statement that the judge made. The only individuals that are given the that are released are the family units from Border Patrol, not the other individuals.
That is correct. Thank you, Sheriff. The undocumented minors that are here unaccompanied, they're by themselves, they're being released, or they're being taken to Lackland Air Force Base in San Antonio, and are not being released as the ones that are here with their families or have family contacts here in this country.
And how many people is that about that are being released with the NPAs?
Yeah, Kevin Pagan, City of McAllen. We think, based on if they're tied directly to the number of people that are dropped off at local bus stations, it's probably in the vicinity of about 200 per day. I reported earlier that since the city started tracking them, we've had about 14, which is about 7 days ago, we've had about 1,400 through the McAllen bus terminal. About 300 of those have stayed overnight. We think that that's about 80%, and maybe a little less than 80%, with the balance of them being dropped off in Harlingen and Brownsville.
Señor juez, ¿y es lo que más preocupa a las autoridades en este momento de la situación que se está viviendo?
right, any law enforcement person?
O
¿Qué es lo que
sea,
más, what is our law enforcement community most concerned about as far as the impact that this influx of immigrants is having on our area? I'm not sure who should answer that, Sheriff? Or?
Well, as far as the law,
in Spanish, I'll be, I can understand in English, but.
well, I'm gonna say it in English.
Okay.
I'm sorry. As far as the law enforcement impact on our community, it's very, very minimal on these on the unaccompanied minors and the family units. You have to understand those individuals come across the river and they turn themselves in to the first uniformed officer that they see, whether it's Border Patrol, Parks and as a matter of fact, our game wardens, Parks and Wildlife, are the ones that are on downriver from the Ansalduas Bridge, and they're the ones that are helping with those units. That's mostly where they're coming across, and so those individuals are picked up by Border Patrol and then taken to the facilities and processed. So as far as an impact on law enforcement services, it's very, very minimal throughout our county.
I'd like to add that.
Go ahead.
Yes, go ahead, Joe.
Joe Rodriguez, Regional Commander for Texas Department of Public Safety. The impact that this crisis brings is it ties up resources, federal resources. So our concern is the security of the rest of the border. As you know, the RGV has been dealing with vehicle pursuits, which have tragic results. That's as a result of human smuggling and drug smuggling. So it is a concern of mine. It is a concern of our state legislatures who I speak to on a regular basis on what can we do. So getting the law enforcement community together to work together to ensure that while this crisis is going on, the transnational criminal organizations do not take advantage of that situation. They see this as an opportunity to exploit not only these individuals that are trying to find a better life, but to take their money and to move and further their criminal enterprise. So for the state of Texas, that's our main concern, the security of the border.
Excuse me, it was brought to light a while back that actually in these countries...
Before you do that, let me try to answer that gentleman's question in Spanish.
Please.
El impacto que está teniendo esto en nuestra comunidad de policías, enforzando las leyes criminales aquí, es mínimo, porque estas familias, estos niños, estos indocumentados que están entrando, se están entregando, no tienen que hacer mucho esfuerzo para detenerlos, ellos mismos andan buscando a los miembros de la patrulla. El impacto más serio que estamos viendo es que estamos viendo que los individuos, los oficiales de la patrulla Border Patrol se están gastando más tiempo hablando y documentando la entrada de estos individuos, tratando de determinar quiénes son, tratando de determinar si tienen algo criminal en su pasado, si acaso están enfermos, cosas de esas, y eso ha tomado mucho tiempo. Y es cuando entra el Departamento de Seguridad Pública del Estado, el Texas Department of Public Safety, para poder hacer lo posible para no dejar que se aprovechen los elementos criminales, en que la patrulla del Border Patrol está pasando más tiempo haciendo lo que le acabo de decir. All right, go ahead, sir.
Question from Open Word News here. For all of you individuals up there, thank you so much for being up there today, doing your part. It's been noted that over the last few years, in many of these South American, Central American countries, there's been advertisements placed and paid for by different groups, sometimes even by the local officials of these countries, telling folks and encouraging them to come to this country knowing that they will receive pilgrimage, welcomage, and at the end of it, there's funding for their travel at the end of it. What have you individuals done on your behalf, sending documentation to these different countries and cities, telling them not to do that? Have you guys written any legal correspondence or anything of that nature, not welcoming them to commit the crime?
Well, I can tell you that from the part of the county, no, we have not. I'm not sure if anybody else here is aware of anything along those lines being done, but we're not, I mean, that's an issue for the State Department. I mean, we've got no, we're not involved in trying to enforce immigration laws. We're not involved in trying to enforce any international laws that may or may not exist or trying to create any. We're trying to deal with a situation that we find ourselves facing as a result of the impact of these immigration policies that are presently in place.
Do we yield then to the DPS officer and to the sheriff?
As far as to answer your question, we haven't done it. I haven't written anybody. I haven't even heard that they are making those messages to those countries. That's the first time I hear of it. Joe?
Yes, we believe that's a tactic. The TCOs, the criminal organizations, again, they're encouraging this because they know that it's going to cause chaos for the Border Patrol to tie up all the resources. So I've had many meetings with state representatives as well as U.S. congressmen, and we're sharing that information. And I know there has been communications, and we also have some leaders on the federal agency actually going into Mexico and having those conversations with leaders of Mexico and Central America. Thank you.
Texas Senator Charities' sole action for me is that he would like to see a state of emergency declared in the valley. We're hearing members of Congress calling on the National Guard to move into the border region. Is that something that our local leaders here want?
Well, at this point, I don't see a need to declare or request that an emergency be declared. I mean, you've heard earlier this morning from the individuals that are involved, and their comments are public health, there's no significant issue. Public safety, there's no significant issue. And those are the two main concerns that we deal with when we're out there talking about declaring emergencies. And I see it at this point, that's not to say it may not happen, but at this point, it's not there yet. Now, I know we have some representatives here that maybe they want to have a different take, or they may have a different take on that question. And they're certainly welcome if we could impose on them to respond in any way if they so desire. We have Mr. Richard Ramon, State Representative from the Webb County area, and Bobby Guerra, State Representative from here in our Hidalgo County area.
Well, all we can do, obviously, is listen to our local leaders explain to us the steps they're taking to deal with this situation here in the valley. As far as declaring an emergency, we have to turn to our local leaders to assist us in determining when that would be appropriate, if that would be appropriate. And I think that we're all monitoring the situation on a daily basis and really on an hour-to-hour basis. Certainly Senator Hinojosa, I think, is concerned about the issue, and his call for an emergency might indeed be very appropriate. We'll just have to wait and see how things transpire.
Representative, in your discussions with Border Patrol, what are you hearing about the conditions for the children themselves? Because some of the Health and Human Services workers are saying privately that the children are describing their conditions as that they're living in ice boxes, they're very cold, they're huddled together to keep warm, there's one toilet per 50 kids. What have you heard today from Border Patrols who are laying fears about the conditions of the children?
Well, I'm glad you asked that question. We do have the pleasure of having the chair of our Health and Human Services Committee, Richard Ramon, here, and I'll let him speak a little bit more to that. But I will say that I have to commend the Texas Medical Association, our local physicians, and all of the community together, because I was at Sacred Heart this past weekend, and your heart has to go out to these children you're speaking about. But I think all of the local leaders are doing the best they can to deal with the situation, and the Catholic Church, obviously, wow, what a tremendous outpouring of support and help, and I think it shows the rest of the state and the nation what we can do here together when we all get together to work on an issue. But again, on those particular issues, the specifics of that, I know that the Catholic Church and Texas Medical Association, local physicians, have been concerned about the health issues, and we're monitoring that very, very closely. And I, sitting on the Public Health Committee, am very concerned about that, and I'm monitoring it daily.
My question is more before they get to the church, before they get to Sacred Heart, the conditions within the Border Patrol facilities.
Let me clarify something. Oscar Montoya, Emergency Management Coordinator, County of Hidalgo. Now, there's two different things going on here. There's the operations that are going on with Border Patrol, and that's an enclosed situation that we are privy to. What we're dealing with, what this was about, was how it's affecting us locally. We can't speak to what's going on with Border Patrol. What we are seeing is that the family units that are being released are in need of showers. They're in need of some humanitarian help. And what we as a region have done is stepped in to fill in the gap. City of McAllen stepped in first to help out the Catholic Charities organization. The Catholic Charities stepped in to help the volunteer families that were going on their own to the bus station to go help the families that were in there. So we want to make sure we're real clear that what we're dealing with here is what's happening here, what's affecting Hidalgo County, and then the region of in and around Hidalgo County. And that is the family units that are being released to the bus station. That's what we're working on right now.
Well, let me just say real specifically with reference to, you all were asking about the term emergency and whether there should be an emergency declared. I read Senator, my good friend Senator Hinojosa's request, the opinion editorial, and the letter to the governor that he sent. If you want to remove the word emergency, if it'll make you feel better, then remove the word emergency. He was talking about funds that we have specifically allocated for emergency purposes, and making the analogy that the strain on the community in many different ways is sudden and should be addressed, and that we as the state should be doing more to help address that, so that the local governing entities and even the private sector doesn't have to bear the brunt of those costs. So he was making the argument for that. He referenced specifically the emergency funds because that's what we called them. But I think one of the most significant things that has been mentioned today by the judge is that last year you had 154,800 folks that were detained. This year, after 5.5 months, I guess, it's 160,000. Whatever you want to call it, it ought to be something that we're all concerned about. And I certainly feel that much as I appreciate, and we have this in Laredo too, the 501c3s, the nonprofits, the church structure that helps us and helps folks out there in the community. They don't have that unlimited resources. And no matter how you define this, the city and the counties, the cities, plural, and the county of Hidalgo and other counties, Cameron, Webb, et cetera, will have to bear some costs. Now, at the state level, the Speaker of the House, the Lieutenant Governor, and the Governor last week announced that they were directing DPS to expend additional resources on this issue, what will total into the millions of dollars. Those resources and the resources that are being used to address this issue should be paid for by the federal government. We at the state level, I think, have shown at times that we can move more quickly. And I think that's what the point that Senator Hinojosa was trying to make. We can move more quickly, and we should. At the end of the day, I do think that people like my Congressman Henry Qued and Congressman Ruben Hinojosa and others will step up to say that the federal government should reimburse us. But we should do everything we can at the state level to contain this issue, to step up and make sure that Hidalgo County doesn't have to deal with this, something that is clearly a federal issue, that the cities don't have to deal with it in a way that they should not have to. You're going to deal with it, and we understand that. But what Senator Hinojosa was saying, and what I believe is, you don't have to call it an emergency, but you ought to be concerned when you're talking about the number of people, and specifically also the issues, like Steve Taylor pointed out, where you have so many of them that are young unaccompanied minors and what we do with those children. So anyway, I understand that the dynamics of being careful how you frame this thing, but it is clear to me that the state needs to do more than just invest more in DPS.
Chairman, I think Mayor Darling said it best this morning when he talked about the sustainability of this emergency that we're dealing with, and I think that's what Chairman Raymond is also making reference to. The City of McAllen and our resources should be reimbursed by the federal government. After all, they're using resources for emergencies such as hurricanes. We commend all for doing that, but again, these resources need to be replenished, and we as state legislators will be pushing for that.
Señor Mendoza, ¿podría decir lo que mencionó acerca del cuidado de las personas que están siendo liberadas, Montoya, perdón, ¿podría decir eso en español lo que mencionó antes el vicesecretario con la que está?
Sí, sí, es importante. La pregunta era cómo nos está afectando aquí localmente la emergencia. Y lo que queremos estar seguros es que separamos las dos situaciones a lo que... Okay. Our phone?
Yeah. Okay, never mind. So you step back and
So lo que estábamos explicando es que hay dos diferentes cosas pasando, ¿verdad? Están afectados, una afecta a la otra, pero lo que la ciudad de McAllen, el condado Hidalgo y las otras ciudades que tenemos alrededor de nosotros estamos trabajando ahorita es ayudándole a los Catholic Charities que vieron una necesidad y están ayudando a 200 gentes por semana. Y eso es lo que estamos tratando de juntarnos, y luego también hablando con el Estado, tocante de ellos hablando con FEMA, que nos puedan recompensar a nosotros todo lo que se ha usado. La ciudad de McAllen yo creo que a este punto lleva $15,000, pero ese nomás en equipo y tiempo, ¿verdad? Todavía falta la gente que estamos usando, los departamentos policíacos que nos ayudan para estar ahí protegiendo, el departamento de salud, lo que ellos están usando. Hay grupos que están colaborando con la ciudad y con los Catholic Charities para ayudar con cosas médicas. Todo eso cuesta. Y le damos las gracias a los del Estado, a los representantes del Estado, que están también mandando el mensaje que si nosotros necesitamos que nos miren como una situación que se necesita fondos y que es algo que nunca hemos visto antes, ¿verdad? So, no podemos tratarlo como un huracán, tenemos que tratarlo como algo que nunca hemos visto antes, diferentes reglas, ¿verdad?
¿Usted considera que esta es la peor crisis que el Estado ha tenido?
No, esa es por eso es la razón que alguien preguntó hace rato qué es lo más importante. Somebody asked earlier what's the most impact we've had. And quite frankly, the biggest impact has been the message that's being sent out to the rest of the world, actually, right, to the rest of the United States, in that we're not being overrun by anything. We're not being attacked by anything. We have a humanitarian crisis going on. Border Patrol, DPS, our local sheriff, our constables, cities have done a great job of protecting the border. However, within that operation, we now have a humanitarian crisis. And that's why we're here to try and fix that. So I'll say it in Spanish. So es importante que sepan que la situación que nos hallamos ahorita no es una... alguien nos preguntó temprano qué es lo que estamos afectados más que nada. Lo que nos ha afectado más es el mensaje que está saliendo, ¿verdad? Nadie nos está atacando. Notamos a que no podemos proteger border? La frontera. No es que no. I hope there's a timeout, right? So, no es que no podemos proteger la frontera. Tenemos al DPS, tenemos al condado Hidalgo, el sheriff, las ciudades que ya se juntaron para proteger lo que estamos haciendo. Nos hallamos en una situación de humanitaria. Y eso es lo que está pasando, ¿verdad? Y se van a acabar los fondos y se van a acabar la gente. So, esa es la razón que necesitamos que los federales también miren que seamos parte de toda la situación que está pasando para que nos puedan ayudar con los fondos.
Excuse me, we have time for 2 more questions. Jacob's been waiting.
Before we ask the question, let me make sure that I clearly clarify. On behalf of Hidalgo County, we would welcome any kind of humanitarian assistance from either the state or federal government or both, and I'm sure the City of McAllen would feel the same way, and I know Sister Pimentel and those faith-based groups certainly would welcome it. All right, let's.
Senator Davis has asked for a state of emergency declared by the state. Agree with that?
Well, it's my understanding I've been told by one of the state representatives that she did not ask for a state of emergency, that she asked for a special session where the governor would then be able to hopefully allow the issue of whether or not they're going to be providing any kind of humanitarian aid to our area. And that's certainly something that we would need. Quería aclarar que lo que ha pedido la senadora Wendy Davis no es una declaración de emergencia, es una declaración que haga el gobernador, donde se junta toda la legislatura a considerar si acaso van a ayudarnos estatalmente con fondos para lo que estamos teniendo ahorita, para poder ayudar a toda esta gente, estos migrantes.
Senator Davis is in town today, as is Governor Perry. What kind of message or communication do you plan on having with the governor?
Well, the governor, as I understand it, is going to be visiting the facility, getting a first-hand look at what we're experiencing. At the same time, he's going to be going to the Weslaco DPS office, I believe, where I think he's going to be looking also at their situation and talking about the need to help out with this surge at the Department of Public Safety, the funds that are going to be needed, so that the time taken away by Border Patrol officers to process these immigrants can then be filled, these gaps be filled by our Department of Public Safety officers.
Does the county, do you plan to take advantage of his presence here to lobby for state funds for humanitarian purposes?
Well, we certainly are going to be talking to them about any kind of humanitarian assistance that is available. We certainly would like to see it happen.
Esta pregunta es para el señor Eddie Olivares del Departamento de Salud. Aparentemente en Centroamérica no se tiene mucho la cultura de la vacunación en los niños. Corremos algún peligro de salud toda la comunidad y ellos mismos, a lo mejor de tener alguna enfermedad o algo, se les está atendiendo. ¿Qué se va a hacer al respecto? ¿Hay suficientes vacunas para ellos?
I'm going to answer in Spanish and English, so that way you both get that.
Translate the question.
Right.
Translate the question also.
Okay, the question was that she's asking basically the vaccination programs in some of the Central American and South American countries are very different than the vaccination programs are in the U.S. Are we seeing any type of concerns or illnesses, or is there any plans to how we're going to deal with those needs? First of all, right now, I just want to say I'm working hand in hand with the Texas Department of State Health Services. We're working hand in hand with the CDC and the U.S. Public Health Service Administration in working with this and collaborating very closely with our CBP partners to determine the illnesses and concerns that are coming across. At this point, I want to make it very clear there is no indication of any communicable diseases, any infectious diseases that are a threat to us at this point. Public health security is a priority. I think if there was a message, this is a great way to explain to the country and to our border and our elected officials the importance of public health safety and security and the importance of surveillance and investigation and reviewing infectious diseases across our borders. Right now, the main focus is helping these children at the detention centers. They are being processed. They have physicians, nurse practitioners, PAs that are all assessing those children and their families. They're being vaccinated as needed and assessed by those entities at those centers. Once they're released, we have a medical group who is volunteering and assisting and assessing the children that are coming. What's interesting is that the illnesses we're seeing at Sacred Heart Church are very common: colds, allergies, scrapes, bumps, dehydration, things like that. But what's interesting is that a lot of these folks coming in, a lot of people always think about the illnesses that are here coming in from other countries, but believe it or not, these children are being impacted by our allergies, by our pollens, by our things. They're not used to this environment here in the U.S. So believe it or not, the biggest thing we're seeing is respiratory complications due to allergic reactions, due to respiratory complications, and those children are having colds, sinus-type illnesses, things like that, because they're not used to our pollens. So for them, it's been different. So it's an adjustment for them as well. So I think the main issue here is that we're all working diligently with our partners to help these children and these family members. The importance of the public health component is vital. Mr. Bobby Guerra, Representative Bobby Guerra, who has been a tremendous advocate, and our representatives as well, who have been a tremendous advocate for public health and health and human services is important. Para nosotros ahorita la cosa principal es para darle asistencia a estos niños que están viniendo con los familiares. Ahorita mismo en los diferentes programas federales tienen doctores, tienen enfermeras, tienen physician assistants para asistir todos los familiares que vienen a tomar parte. Ahorita no hay ni un tipo de enfermedad que tenemos preocupación, está todo bajo de control. No se ha visto problemas serios tocantes las enfermedades. Nosotros estamos vigilando todo muy cerca, estamos comunicándonos con nuestros amigos en México, la Secretaria de Salud de México también. Estamos trabajando mano a mano con ellos para asegurar que todas las enfermedades estén abajo de control. Ahorita mismo los niños están visitados por los diferentes doctores y enfermeras en las oficinas federales. Al nivel aquí local, donde está la iglesia, tenemos doctores, enfermeras y todos los equipos que están ayudándoles a los niños. Las enfermedades que se están viendo más común son problemas con alergias, donde los niños están batallando porque es diferente aquí, el ambiente es diferente, todo es muy diferente aquí en los Estados Unidos comparado de donde vienen ellos. Hemos trabajado bastante bien con los doctores y los enfermeros. Lo importante también aquí, estamos haciendo planes para correr este programa por varias semanas. De parte de nosotros, como dijo el juez Garcia, es importante que asistencia humanitaria es muy importante a los niveles estatales y federales, por eso a los niveles políticos, no a los niveles aquí locales. De parte de nosotros le damos gracias a todos los voluntarios que han dado asistencia.
You did it in Spanish and English.
Yes.
My Spanish is not that good, so.
I have a question.
Any other question?
City of McAllen. The mayor said previously that McAllen spent $15,000 last week. Is that right? What have been the expenses so far, and what have you all predicted for the rest of the summer?
The amounts, Davis, or the categories of things? Well, the amount was an estimate from my incident commander, Josh Ramirez, and it had to do with deployment of the city resources, which included the showers, bathroom facilities, traffic control. I think there was some element of personnel costs in there, but I don't think nearly all of the personnel costs was captured in that. I think we estimated that it would, to sustain our support of the operation at that level, would probably run about $20,000 or $25,000 a week if we sustained it at that level. Happily, the county has stepped in already. Some of our cities have stepped in to help backfill those needs. So those are the things that we're spending the resources on.
I'm sorry, has the City of McAllen reached out to the sister city of Reynosa to address this problem? Because these kids are crossing to Reynosa.
I don't think we've made any the mayor has made any request to Reynosa at this point. Our request has been simply among our cities on this side of the border and the county for the assets that we need to respond to the humanitarian part of this that originated at our bus terminal and has now moved to Sacred Heart. But so far as I know, we have not made any requests to cities across the border.
Do we know what the cost is for the county in addition to the city?
Well, we have provided about 8 staff people to assist in the effort, and we've provided some equipment, the showers, the portable showers, portable restrooms that are out there were provided by the county. So it's been nominal.
The meeting this morning, did you get out of it what you hoped to when you called it?
Yes, I for one am very pleased with the turnout, the different departments, agencies that were here today. The interest is clearly there, and I was very happy to see that we could communicate directly with them through your assistance. We're going to be communicating with hopefully the rest of our community and trying to provide them with accurate information. The worst thing that can happen is all these rumors out there flying around and everybody has a different take on them. And that's why we're here making the time and the effort to answer your questions.
Did they talk about any new detention facilities here in the valley?
Any what, sir?
Detention facilities, temporary detention facilities, the whole families here in the valley?
They did not talk about that, no. They were not asked about it. I'm not sure. I had heard that there was discussion about one located out there near the Border Patrol facility. but I don't have any accurate information that I can say is accurate, so I better. Oh, Kevin.
Just to be clear, because we had received a public information request for the city, the Border Patrol has entered into a lease, I believe, for a building within the city of McAllen that we understand, and we have worked with them to expedite the permitting process for the remodeling, and I believe that is to supplement their Border Patrol station, which is located on Military Highway here in the city of McAllen. So as far as formally knowing about that, I believe that is a detention facility, and I believe that is for the Border Patrol as opposed to any of the other federal agencies, but that is here in the city of McAllen.
Are you at liberty to give us the address of that facility?
I would if I could remember what it is. I believe it's on Ursula Avenue. So I believe it's on Ursula Avenue. I don't remember the.
Do you know if this is the first of others to come up? I know it's a substantially large facility, like 55,000 square feet. Are there any other spaces within Hidalgo County that are being eyed for potential?
We have assisted them in identifying facilities within the city of McAllen that they might be able to use for both detention facilities and the humanitarian response. We've just assisted in identifying some of those facilities. That, to my knowledge, within the city, I can't speak to the county or surrounding city, but within the city of McAllen, that's the only one that I know of that is in the permitting process.
Is there a concern that this humanitarian issue is considered off potential businesses into this area because of our humanitarian issue?
Sandra, I'm sorry. Can you repeat that?
Is there a concern that this humanitarian issue here is scaring off potential businesses?
No, I don't see. I think if anything, it shows a compassionate community. What we're trying to avoid is a perception that that the criminal element is prevalent here in our area, that the health situation is at a crisis, which it's not. Neither of them are. And that's the message that we're trying to communicate throughout our community and throughout our state and nation.
Eddie, when you were talking about people getting vaccinations at the holding facilities, is that at the Border Patrol facilities or at these secondary shelters like the Sacred Heart and others?
Well, frankly, I'm not. Eddie, you want to speak to that? Yes.
The vaccinations, my understanding is that the CBP officers and their teams have worked on vaccinating some of the children that may have been exposed. I think it's primarily chickenpox. There was like 5 cases out of the thousands of people that have come through. There was 5 cases of chickenpox that were documented by CBP. I'm not sure the exact location. I know throughout their whole operation. And out of those cases, they vaccinated the immediate family unit members that were with them as part of a vaccination component. So there has been some vaccines given by CBP and their officers in direct response to a potential concern with chickenpox, but those are the only situations that I'm aware of. There was also one concern about tuberculosis and one potential case, but that was not substantiated. And also, I want to please, while I have you all, there is no measles. None. 0. There was a rumor going around about measles. There isn't any problems with measles, because if there was, I wouldn't be standing here right now. Okay.
Yes, sir.
I've heard 2 things. Number one is that no one from the federal government is giving women and children any money at the bus stations to get from point A to point B. And then the second question is, the men, not the women and children, but the men.
Why don't we answer your first one? We are not spending any money here to pay for their bus trips.
No. No. I should probably answer that because I think I was perhaps. I did an interview in which it might have been interpreted, my comment, that they were being provided bus tickets by the federal government. That is not true so far as we were able to ascertain, Greg, that the bus tickets that they are arranging at the detention facility are being either arranged by relatives of the detainees while they're still in detention, but by the relatives at the location where they're going, or by resources that the detainees have with them or wired to them on their person. There is no, in fact, I would say that I have been directly informed that they are not providing transportation resources for those folks that are being given the NTAs and dropped off at the bus terminal, but that the dropping off at the bus terminal is just an accommodation to help them meet their bus schedule.
You had a second question?
Well, I just wondered, you know, it seems like two groups, single children, and there's the women and the children, and the men. I was wondering, has Homeland Security given you county and local assurance that they are doing the necessary screening by checking criminal records back in their home countries before, and are they actually being released?
No, I mean, I saw that firsthand. I mean, they are screening everybody that they have detained there, whether they're minors or not. And as to the adequacy, I can only assume that they know what they're doing. They've been doing it for a while, and I'm sure that we're getting accurate information. Any other questions? If not, we certainly want to thank you for assisting us in trying to communicate some accurate information.
Thank you very much.